Greetings of the day, folks. In this video, we shall discuss about CIWA scale. CIWA stands for Clinical Institute Withdrawal Assessment for Alcohol. This scale has been revised, and this consists of 10 components: nausea and vomiting, tremor, tactile, auditory, and visual disturbances, anxiety and agitation, headache, and orientation and clouding of consciousness, and paroxysmal sweats. These components have been graded of the based on severity of the manifestations of the withdrawal symptoms. So, coming to the nausea and vomiting, the patient should be asked whether in the following manner: do you feel sick to your stomach? Have you vomited? And based on the observation, we can grade the manifestation. 0 is no nausea and vomiting, 1 is mild nausea with no vomiting, 4 is intermittent nausea with dry heaves, 7 is constant nausea and frequent dry heaves and vomiting. The second component is the tremor. The arms extended and fingers spread apart. And observation is that patient, if there is no tremor, that is scored as 0. If there are not visible but can be felt fingertip to fingertip, then it is graded as 1. 4 is moderate with patient's arm extended. 7 is severe even with arms not extended. Third component is the paroxysmal sweats. The observation is that if there is no sweat visible, it is graded as 0. And if there is barely perceptible sweating, palms moist, though, it is graded as 1. 4 is where beads of sweats obvious on the forehead, and 7 is drenching sweats. Next is the anxiety. Patient should be asked, do you feel anxious or nervous? Then the observation is, if there is no anxiety or the patient is at ease, then it is graded as 0. If there is mild anxiousness, it is graded as 1. If there is moderate anxiousness or guarded, then anxiety is inferred. Then grade 7 is where when patient is like having equivalent to acute panic states as seen in severe delirium or acute schizophrenic reactions. Then next is the agitation. If the patient is having normal activity, it is graded as 0. If the patient is having somewhat more than normal activity, graded as 1. Moderately fidgety and restless, then it is graded as 4. And if the patient paces back and forth during most of the interview or constantly thrashes about, then it is graded as 7. Then coming to the tactile disturbances, if the patient is having, and we should ask the patient, do you have any itching, pins, or needle sensations, or any burning, or any numbness? Or do you feel bugs crawling on or under your skin? Then observation is that if there are none, it is graded as 0. If there is very mild itching with pins or needles, burning, or numbness, then it graded as 1. You can see here 1 2 7 are complete here. 1 is very mild, 2 is mild, 3 is moderate, and 4 is moderately severe hallucinations, 5 is severe hallucinations, 6 is extremely severe hallucination, 7 is continuous hallucinations. Auditory disturbances. Patient should be asked, are you more more aware of the sounds around you? Are they harsh? Do they frighten you? Are you hearing anything that is disturbing you? Are you hearing things you know are not there? Observation is that graded as 0 when they are not present. Very mild harshness or ability to frighten. Mild harshness or ability to frighten is grade 2. Scored as 3 is the moderate harshness or ability to frighten. 4 is when patient is moderately having severe hallucinations, and 5 is severe hallucinations, 6 is extremely severe, and 7 is continuous hallucinations. Coming to the visual disturbances, does the light appear too bright? Is its color different? Does it hurt your eyes? Are you seeing anything that is disturbing to you? Are you seeing things you know are not there? Observation is that 0 is not present, 1 is very mild sensitivity, 2 is mild sensitivity, 3 is moderately sensitive, and 4 is moderately severe hallucinations. Okay, and 5 is severe hallucinations present, 6 is extremely severe hallucinations, and 7 is continuous hallucinations. If the patient is having headache, or we must ask about inquire about the headache, whether there is any fullness in the head or not. Ask, does your head feel different? Does it feel like there is a band around your head? Observation is that 0 is 0 when it is not present. 1 is when it is very mild, 2 is mild, 3 moderate, 4 is moderate severe, 5 is severe, and 6 is very severe, and 7 is extremely severe. Then coming to the orientation and clouding of consciousness. Ask the patient whether what day is this and where are you and who am I. Observation is 0 is oriented and can do serial additions, 1 is cannot do serial additions or is uncertain about date, 2 is disoriented for date by no more than 2 calendar days, 3 is disoriented for date by more than 2 calendar days, and 4 is when disoriented for place or person. So this is graded only from 0 to 4. That's why we are having what? 0 to 67 score range. So when the score is less than 8, it is considered as mild withdrawal and no medication is necessary then. If the score is 9 to 15, it indicates moderate withdrawal and dose medication every 2 hours. And if the score is more than 15, it indicates severe withdrawal and dose medication every hour. So this is what the CIWA score is all about. So practice it for getting the edge around it. And thank you very much for watching the video. Thank you.